secondary to infectious diseases like pertussis or measles, or some bacterial cause like congenital heart disease, uh, and cause sinusitis, rickets, bronchial asthma may occur in the young initially as the bronchitis. Clinical picture. As a rule, constitutional disturbances are many. Cough is the most important symptom and may be dry, brassy, or harsh. Vomiting may occur from a violent bout of cough. Low-grade fever, chest pain, expectoration may all be present. Physical signs in the chest often reveal scattered rhonchi and rale over both intrascapular area. An audible wheeze may be heard in some cases. And a more serious condition after bronchitis, it may go to pneumonia. Pneumonia is common at all ages and occurs both in infants and older children. Clinical features, irrespective of the etiology, of the various types of pneumonia, they are all characterized by a sudden onset of elevation of temperature, that is from 102 degrees to 104 degrees Fahrenheit, and cough, dyspnea, that is both the ala of the nostril, they dilate with each breath. You can see that the nose will be blowing, that is, it will be enlarging. And tachypnea, that is increased respiration, 40 to 80 respiration per minute. Tachycardia, more heartbeat. Pain in the chest, grunting, lower intercostal recession, that the muscles of the intercostal region will be drawn inside, and distension of the abdomen, and abdomen will be distended, may all be present. Sometimes convulsions may occur. Rusty sputum may be observed only in older children. There may be vomiting, anorexia, and refusal of feed. Clinical examination will reveal the altered breath sounds typical of lobar bronchopneumonia. The WBC is often elevated. Ayurvedic view. In children, the pranavaha srodhas easily gets affected with the diseases as their agni is aniyada, that is due to ahara sangaratva and due to their weakness of dhatu excellence. Moreover, the site of pranavaha srodhas is at kavasthana, and children are more kapha predominant state. So mostly kapha diseases are encountered with the pranavaha srodhas in children. Nishtanna purasat atyushnam swasastasyo upajayade, exhales hot breath from the chest, that is kapshirva samida shutrasthana. In children, Shwasaroga can occur by preceding conditions like untreatable kasa, gastrointestinal tract infection, amadisara, aspiration of vomiters, that is vamadu, regurgitation is useful cause of aspiration. Aspiration of vomiters, that is vamadu regurgitation, the vomited material, sometimes it may go into the trachea and into the lungs, is a usual cause of aspiration. Toxic or anaphylactic, that is visha, can also be a cause of the problem. Hemolytic disorders in infants, that is pandu, or with chronic anemia. Pulmonary diseases, that is jwara or allergic factors, rejo, duma, anilai, himambuna, kasapradya bhavet shwasa, purverva doshakovanehi, Amalisara, Vamadu, Visha, Pandu, Jure, Ravi, Rajo, Duma, Anilair, Marma Khadat, Adi, Himambuna, Ashtanga de Nidana. Bronchial asthma in childhood is defined as the hyper responsiveness of trachea. It is a what you call that something like an allergic reaction. Bronchial smooth muscles to a variety of stimuli, resulting in partially or completely reversible narrowing of the tracheobronchial tree, often accompanied by increased secretions and mucosal edema, presenting clinically as paroxysmal dyspnea accompanied by wheezing. Samprati, Kapo Uparuddhagamana, Pavano, Vishwagastita, that is Prano, Udaga Annavahini, Dushta Srodamchi Dushen, Udasta Kuride Shasam, Amashaya Samudbhavam. So in Ashtanga, it has been mentioned that it is the cause is mainly Kavaja, and Shwasa originates in Amashya, but the manifestations are seen in the Uras. Vada gets obstructed in by Kapha, remains static in cubic direction. It will be blocking the Shwasapatha and vitiates the prana, udaga, and annavasrodha, resulting in Shwasaroga. Treatment is since Panchakarma Shodhana like Vamana are difficult to be performed in children. Samana Aushadha Prayoga is more effective. Arishtas like Vashagadya Arishta, Kanagasava, Tripalyasava, Chiragadya Arishta, and Kashayams like the Samula Kadatraya, Belajiragadi, Indugandam, Churnams like Talisabatradi, Vyoshadi, Harpuradi, Gudigas like Vayu Gudiga, Shwasanada Gudiga, Shwasa Kutara, and Chukuntipilyadi Gudiga, and Basmas like Abraga Basma, Tamra Basma, Lehyas like Agasti Rasayana, Kushmanda Rasayana, Ajamansa Rasayana, Desamul Rasayana are found to be effective. Now coming to some infectious diseases which are modern. Dengue fever. Dengue fever occurs sporadically in coastal areas, occurring in intervals of years, attacking large sectors of the population, but it is not common in children. The virus which is transmitted by the Aedes aegypti is infective to the other mosquito, which infects man 2 weeks later and remains there till it dies. Clinical features. The incubation period is from 5 to 9 days. The onset is sudden with a headache, rigor, high fever, severe backache, and joint pain, which persists throughout the course of the illness, giving it the name of breakbone fever, because such a excruciating pain in the bones will be felt. There is supraorbital pain around the eyes, and mouth and eyes are infected. The face and extremities appear flushed. The fever comes by crisis on the 5th day and remain normal for 2-3 days. But a secondary rise for a day or two occurs. That is just like a saddle sitting on the on a horse, just like saddling. It will be just like a jumping. The fever will be jumping with increased joint pain and appearance of a characteristic rash. Forms first on the hand, then extending to the whole body and fading away in 2 or 3 days. Bradycardia, not marked in children, and leukopenia occur. The diagnosis is difficult because before the appearance of the rash, the virus is isolated from the blood during acute stage of the disease. Treatment is symptomatic and supportive. Analgesic are required for pain and discomfort. Complications such as hemorrhages and shock may require sometimes may require blood replacement. And the complications are asthenia and joint pain, muscle pain and joint pain may continue for weeks. And many patients have complained of knee or ankle joint may persist for months, causing difficulty. Ayurvedic medicines like Guduchadi Kwada, Vetumaran pills, Vilvadi Gudiga, Padola Kaduronya Kashaya, Amrdarishtam, Pipalyasvam, Gorodhanadi pill, Sudarshana Ganavadi are effective in this condition. Now, another new era disease is chikungunya, an epidemic resembling hemorrhagic fever, starting with convulsions in the infants and young children, and fetal deaths were reported in pregnant women. Joint sequelae were common, involving wrist, ankle, knee joint. The disease was reported to be due to chikungunya virus transmitted by Aedes aegypti. It mostly bites during daytime. And treatment is symptomatic, almost on the same line of dengue fever. Now, a very important fever is typhoid. The incidence of typhoid fever is universal. In the tropical areas, however, it is endemic in many places due to low standard of living, unprotected water supply, and unhygienic methods in preparation and handling of food. The disease is transmitted through the oral route from contaminated drinking water, milk, or other food, ice cream, contaminated vegetables, etc. The source of infection are patients suffering from the disease or from excreta of carrying fomites, that is just like handkerchiefs or any towels or dress what the patients are using may be a cause for the infection to others, may also play a role in the spread of the disease. The housefly helps in disseminating the infection. About 20 to 30% of typhoid fever cases occur in children below 10 years. It is rare in infants because they are usually breast. Very small infants, it is very rare because mostly they are breastfed. The pathology of the disease, the organisms are gram-negative, known spore-forming bacilli, Salmonella typhi and Salmonella paratyphi, A, B, or C. They make entry into the bloodstream through the intestinal lymphoid tissue and infect the liver and spleen. They also multiply rapidly in these organs and reinfect the blood and the alimentary canal. The Peyer's patches, especially we can see on the tongue, get swollen, they necrose, and later form ulcers, which may potentially lead to hemorrhage, and sometimes intestinal perforation also may happen. The spleen and mesenteric gland are enlarged. The toxins released by the destruction of the bacilli cause toxemia and involvement of many vital organs. Clinical features. The incubation period is usually between 8 to 21 days. And in majority of the cases, the onset is sudden with a headache, malaise, and low fever. And especially in infants and young children, it may be abrupt with chills, high fever, convulsion, resembling meningitis, or it may stimulate acute bacillary dysentery with vomiting and diarrhea, or an acute respiratory infection with cough and bronchitis. The spleen is enlarged, and there may be a slightly enlarged liver, which is soft in consistency. The abdomen is moderately distended, and diarrhea or constipation may be present. The temperature gradually increases in a step ladder pattern. Just like climbing up the ladder, the nature of the fever will be like that. And the evening temperature is higher than the morning. Diagnosis: how to diagnose the typhoid condition? Isolating the organism, blood or blood or bone marrow culture may be positive in 90% of the cases in the first week. Urine and stool culture generally becomes positive during the third week. Serological test, or generally we call viral test, may be positive by the end of the first week. Blood smear, that is a leukopenia with relative monocytosis. Absence of eosinophils has some diagnostic value. Eosinophil count will be very less in this condition. Elevated ESR and CRP also will be positive. Treatment: administration of Jara medicines, especially Indugandha Kashaya. Indugandha, it is mentioned that Nimnonad Jarahara. So when there is a step ladder type or fluctuating type of Jara in typhoid, Indugandha is very effective. And the Deshamolaka Kashaya, then Amrita Arishtam, Pipalyasavam, Mustarishtam, Parpadagatyarishtam, and Vishamadjurandhaga pills. It's a special pill which mostly we use in Kerala. Gorajnaji pill, Sudarshana Ganavadi, Agni Kumara Rasa. These are all medicines which can be used in the treatment of typhoid. Now, another serious condition in children is diarrhea. Diarrheal diseases in infancy still constitute one of the chief problems in pediatric practice. The situation with regard to infantile gastroenteritis is even at present depressing. Diarrhea is probably still the commonest cause of infant mortality in most tropical and subtropical countries. Newborn, young infants, and malnourished children, because of their immature immunological response, are particularly susceptible, especially if they are not breastfed. Moreover, they are especially prone to dehydration and electrolyte imbalance, which usually accompany the condition. Water is lost in enormous amounts in the frequent liquid stools of acute diarrhea caused by hyperperistalsis. Along with it, electrolytes, especially sodium, that is Na, potassium, K, and bicarbonate, HCO3, are lost. When the condition is accompanied by copious vomiting, further loss of fluid, as well as chloride, and a little bit of potassium present in the gastric content take place. In infants, the kidneys are immature and unable to concentrate urine and conserve water for the body to the same extent as adults do during such periods of stress. Insensible loss of fluid through the skin and lungs, aggravated by fever, high environmental temperature, and that is a excessive breathing of acidosis also added to the fluid deficit. The infant is unable to replace the losses because, unlike the adults, he cannot reach for water. Anorexia, as that is the loss of appetite, as well as vomiting, when present, may also prevent effective oral intake of fluid. Besides the assimilatory mechanism of the intestine, it is impaired in diarrhea, precluding the normal absorption of nutrients. The events tend to produce firstly dehydration or reduction in the fluid volume of the body. The blood plasma is the first to feel the fluid loss, but this is promptly replaced by interstitial fluid. But if the process is rapid and continued, the compensatory mechanism failed. There is marked reduction in the interstitial fluid volume, followed by concentration of plasma volume. The blood pressure falls, leading to peripheral stasis and cellular anoxia with the accumulation of products of incomplete carbohydrate mechanism. Finally, shock, characterized by skin cold extremities and rapid thready pulse may supervene. Clinical appraisal of the dehydration consists of noting the extent of loss of weight loss well below 5% is mild dehydration. Between 5 to 10% can be considered as moderate, and above 10% indicates severe dehydration. The skin turbidity or turgor of the skin, condition of the eyes, and mucous membrane of the mouth, the character of the pulse, urine output, and the state of the anterior continent will be vital. It is characteristic clinically by irritability, occasional shrieking cry, excessive thirst, a dry parched tongue, and a duffy feel of subcutaneous tissues. Delirium, convulsions, and coma may occur, and the brain damage that sometimes ensues may become irreversible. Ayurvedic view, Adhisaranat Adhisara. In Ashtanga, the explanation of Adhisara is given like Adhisaranat Adhisara because excessive saratva of fecal matter. And Atyanta Saranat Adhisara, that is Sushruta has in Nidana, he has told that Atyanta Saranat Adhisara. The etiology or Deha Vaivaranyam Aradi Mugaglani Anidrada Vadakarma Nivritti Tetyate Adhisara Ugravedana. That is discoloration of the body, uneasiness in the mouth, that is distaste, and fatigue, insomnia, absence of functions of Vayu. Adhisara is a very common disease met in pediatric practice. The excessive sarana of Purisha Yukta up Dhadu through Adhomarga is termed as Adhisara. Nidana. Adhisara Sudaram Jayade Atyambu Manada Krisha Shushka Amisha Asagnya Tilabishta Virudhagehi Madhya Dusha Adimatra Anna Arshobi Sneha Vibhrama Krimibhyo Vega Rodhascha Ashangrade Nidana. The main cause of Adhisara is Vayu Vritti, and the factors contributing to this are dietary factors, as we have seen earlier, and diseases produced by krimi, cholera, dysentery, etc. Psychological, that is stress, fear, etc. And Tanya Dushti,